everyone. In today's clip, I will talk a little bit about migraines. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health related matters, please consult your healthcare provider. So, a migraine is a headache that can cause severe throbbing pain or a pulsing sensation, usually on one side of the head or both, and it's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so bad that it actually interferes with daily activities. For some people, a warning symptom known as an aura happens before or with the headache. An aura can include visual disturbances like flashes of light or blind spots or other troubles like tingling on one side of the face or an arm or leg and difficulty speaking. The frequency of migraine varies from person to person. Some might get it one a year and some one a week on average, and most people experience it, let's say, 2 to 4 times a month. When we have headache, specific nerves in our blood vessels send pain signals to our brains, and this releases inflammatory substances into our head's nerve and blood vessels, causing migraine. The triggers include things like stress, hormonal changes, medications, sleep pattern changes, weather conditions, too much physical activity, addictive substances, missing a meal, sometimes even aged cheese, alcohol, food additives such as MSG, processed food, cured meats, and so on. There are, of course, an extensive list of prescription medications for migraines, and none of which are free from side effects, of course. So in orthomolecular medicine, the treatment once the migraine starts is by combination of supplements such as magnesium, B-complex, coenzyme Q10, vitamin D, and melatonin, as well as a small cup of espresso, let's say. Metaphysically speaking, migraines are a buildup of emotional pressure. How much can you take? There's a pressure to decide to say yes or no, and often ending up saying yes when you really want to say no. It is also common to find yourself in conflicting circumstances which you feel unable to escape from. Should I stay or should I go? Your personal boundaries become blurred, and as a result, resentment builds up. Resentment for yourself and towards others. People who suffer with migraines often feel overwhelmed by having too much to do. There are unspoken words that you dare not to speak for fear of rejection or abandonment. There may be an underlying sort of longing for mother's love, coupled with a fear of rejection and a deep need for acknowledgement and to be heard. Migraines are a natural way for a forced boundary. A migraine allows you to say no or stop a behavior that would tip you over the edge, basically. Migraines can unconsciously be an opportunity for you to get out of things as you're unable to say no to. There's a feeling of underlying pressure not to deal with things, basically. So migraines, although deeply unpleasant, give you an out from the pressure to perform a certain way to please others. They also give you a chance to escape from a situation that you're finding too overwhelming, as you're unable to say what you really feel or think. Awareness of the emotional aspect to migraine enables us to do something about the pattern of behavior that created the migraine in the first place. To change ourselves and transform how we deal with life and other people is enormously helpful, of course, when getting to the bottom of the migraines. If you feel migraine is coming, some of the things that you can ask yourself is, do I feel under pressure and tense? Am I feeling anxious and fearful? Am I expressing a huge amount of internal pressure to be on top of my situation? Do I have a strong need to escape from this reality? Do I find it challenging to let go of situations, people, and problems and distrust the universe? Do I try too hard to be perfect? Am I a person that desperately needs to achieve, always seeking to get ahead? Do I have high expectations of myself or others? Do I feel disappointed when others do not meet my expectations? Do I feel anxious about my competence and lack of confidence? Or do I lack confidence, pardon me? Is there a deep need to save or rescue others? Am I seeking approval from my mother or other authority figures? Do I feel unworthy to be loved and nurtured? So in prevention, take a good look at your personal and professional life and see who or what places demands on you that overwhelms you. Look at those people that do not acknowledge or listen to you, to who you are. Release the emotion in the body and try meditative exercises and keep breathing. Hope this has been informational. Like and follow for more. Be the light.